Tell us about SyncThink, which is your company and what you're trying to do in healthcare and how you got into this.
Yeah, so SyncThink's all about attention. And so
attention?
Attention, how you pay attention. We're looking at people's eyes.
I have very little attention.
We're going to help you.
Okay.
So you look at people's eyes, see they're paying attention. So we're interested in objective measures for attention. Right now it's very subjective. And attention-related disorders can affect everything from ADHD to concussion to dementia. It's a very prevalent neurological problem that we don't have good objective measures with.
We don't really measure your attention span.
Right, span, how well you pay attention, which can get affected by sleep deprivation. A lot of people are on the job sleepy and they don't perform well because they can't pay attention.
I've always gotten a full night's rest every night of my life, so I'm not really familiar with what you're talking about, but go ahead.
Yeah, I'm a surgeon as well. So we have residents, and you know what happens to residents, right? Okay. So SyncThink is really has the analytics and the platform to measure attention very quickly with eye movements. And we basically use VR goggles with eye trackers in them. And we present a dot going around a circle, and within 60 seconds of putting the goggles on, you have a full report of how well you pay attention.
So it's like an eye test, but for attention.
Yeah, most of your eye tests are static, right? The thing is just there, it doesn't move. And you know, you go to the DMV to have your eye tested. Well, most things in life are moving, they're not static. When they move, you have to predict. And what we're measuring is prediction, which is really attention.
Okay.
And you have to be in the future to interact in the present, to be aware of the past. Because it's impossible to be in the present.
What do you use this information for?
So we use it right now for concussion. So we're doing a lot for eye tracking impairments, FDA approved for eye tracking impairment. So we have it right now. All the Pac-12 schools use it. We have a lot of other schools.
For sports injuries,
sports injuries,
trauma,
it's a platform, concussion,
motor vehicle accidents,
and,
falls.
Yeah, a lot of hospitals, MGH, Cleveland Clinic, Stanford.
Okay.
They're all using it. We have teams using it. We have NBA. They're really using the NBA is using it for performance.
Wow.
So once you know somebody's attention, you know, we can pick players and we can actually try and improve their attention. So a lot of different uses for this technology.
Wow. Is it done right after the injury, or is it done more to follow patients on a chronic?
No, we can do it right away, right after, but it can also work anytime afterwards as well.
How did you get into this? What type of surgeon are you?
I'm a neurosurgeon, so I operate in the brain.
Is that brain?
That's brain.
Okay.
So my DNA is traumatic brain injury. So I'm also president of the Brain Trauma Foundation. We do the national guidelines for traumatic brain injury.
Oh, great.
But part of traumatic brain injury is concussion.
Yeah.
And so we notice a lot of people with concussion have attention problems. And we can measure it very quickly with eye tracking. It's now eye tracking is known to be a parameter that's changed after concussion. So you should be measuring eye movements, you should be measuring vestibular function, and you can correct it. So the Stanford athletes, I take care of all the Stanford athletes, generally within a week they're better because we exercise them, we give them treatment for their impairments, whether it be vision or vestibular problems.
Would you say this sort of applies math and science to what we've been kind of subjectively doing for a while?
That's a very good way of putting it. A lot of the neurological examinations, sort of subjective way of trying to get at people's orientation and attention, this provides the metrics. And we also can give feedback and improve your attention.
Interesting, wow.
So you're welcome to come anytime.
Okay, thanks. Well, maybe I might need it.
Okay.
So that's great. Jam, great to meet you.
Great meeting you
Thanks
too.
for being on the program here.
Thank you.